In this video, I'm going to be talking about Fraxel laser treatments. Fraxel laser treatments are a form of fractional laser treatment. Now, what I mean by fractional laser is that the laser beam is actually not hitting every part of the skin. So you get little islands of laser energy in the skin with surrounding parts being unaffected. There are certain advantages to this type of laser treatment. In particular, it helps reduce the risk of laser treatment as well as reduce the recovery time. The other advantage is that you're able to penetrate into the skin quite deeply if you need to, which is good for the treatment of acne scarring. The Fraxel laser has two wavelengths, 1550 nanometers and 1927 nanometers. These are two different distinct laser wavelengths which have different effects on the skin. The 1550 Fraxel wavelength is a deep penetrating laser which is primarily used for the treatment of scarring, in particular acne scarring on the face. The 1927 nanometer wavelength is a very superficial penetrating laser which is better for skin rejuvenation, improvement of skin pigmentation and improving skin tone. So who is suitable for Fraxel laser treatment? As a rule, Fraxel, because of its fractional nature, can be used on virtually any skin type from very fair to dark. As with most cosmetic treatments, it cannot be used during pregnancy. It also must be used very carefully or avoided whilst on Roaccutane, which is a drug for the treatment of active acne. The Fraxel laser, I believe, is not particularly good for the treatment of wrinkles. And if you have wrinkles that you'd like treated, you're better off having a carbon dioxide laser resurfacing, which is much more effective. What is involved with Fraxel laser treatment? The first step is to have the face washed and numbing gel applied. The numbing cream usually stays on for about 1 hour. In most cases, numbing cream alone is adequate for analgesia. However, in some deeper acne scarring cases, we may need to inject local anesthetic or use Penthrox, which is a stronger inhaled anesthetic to help relieve pain. The treatment is performed by one of our laser therapists or nurses, and the Fraxel laser is passed systematically across the skin with a rolling motion. During this procedure, cold air is blown over the surface of the face whilst the laser is being applied. This helps to reduce any discomfort as well as cool the skin in order to reduce any complications from the heat of the laser. After laser treatment, we also encourage you to use the cooling hose over the skin to help further cool it down and make your post-treatment time more comfortable. There will be a prickly sunburn sensation to the skin after the treatment, and this may last for a couple of days. The skin appears a little bit red and slightly swollen afterwards. After a few days, you may notice the appearance of scabbing, or a very fine scabbing, like a mesh over the skin, and this naturally comes off. It's possible to wear makeup virtually straight away after your procedure. However, depending on the severity or the intensity of the treatment, it may be necessary to take a couple of days or more off your usual activities or work. Although the fractional nature of the Fraxel laser does impart a degree of safety to its treatment, there are potential risks and complications with the procedure. Firstly, it is possible that you do not achieve the desired outcome from your laser treatment, although again, because it's fractional and not all parts of the skin are being treated, usually multiple treatments are required before you get an improvement. Changes in the pigmentation of the skin, most commonly darkening of the skin, can occur with Fraxel laser, and if this does occur, usually a lightening serum will be needed to return the skin back to its original color. Infection is not a common complication of Fraxel laser treatment. Because the Fraxel laser is non-ablative, which means that it doesn't take off any skin, the skin layer is left intact. However, occasionally a cold sore outbreak does occur due to the irritation of the skin. If you are prone to cold sores, please inform your doctor and we can give you some prophylactic medication to help prevent this. In conclusion, the Fraxel laser is an excellent laser because it balances very well the potential risks and side effects of the treatment with the potential benefits of treatment. It minimises downtime for the patient, but then also requires multiple treatments. So it's a good compromise and a good balance overall. In particular, with people having such busy lifestyles nowadays, the Fraxel laser is able to fit into your lifestyle more easily than a conventional laser and still achieve excellent results.